Hi, my name is Amanda Hollowell, and this is my video reflection assignment. Starting off with the first question, what specific cultural or spiritual beliefs or practices were in play? Well, first off, I am currently working at a Native American hospital, which serves both reservations, which it's right on the border of. Both reservations being the Ho-Chunk. It's technically owned by the Winnebago Ho-Chunks, but also serves Omaha Nation, and that's where I'm from the Omaha Nation. But it also serves other Native American members that are enrolled in different tribes. So because of this, even though I had an issue, because even though both tribes are together, are closely located, I should say. They're right next door to each other. A lot of cultural beliefs and values and their traditions differ. And I guess that's something I never really thought of, even though I grew up here my whole life. But now that I'm working more in the Bago Ho-Chunk reservation, I'm realizing that there is a lot that differs in their beliefs than my Omaha ways. So this time was during an end of life care. For instance, Omahas, they face their head west and then their feet east when they're transitioning to end of life, and Winnebago Ho-Chunks do the opposite. They face their head east and their feet west. So that was something new to me. I had at the time tried to put the patient the way that the Omahas did, and the family was like, no, we don't place them that way. We place them opposite. And so this was a time, same thing with prayers. Their prayers are a little bit different, and even though we still do the same, the smudging off and things, some of their prayers are a little bit different, like with eating. When you're eating, leaving windows open, or setting out plates for other spirits that might be following the patient. Just different things like that with prayer. There's a lot I could go on with Native American culture, and something I'm learning newly is learning the difference between tribes, realizing that even though we're all a lot alike, there is a lot that's different, and putting away my own bias and my own understanding of my own culture to make sure that I'm providing the best culturally sensitive care to my patients. Number 2, how did or would those beliefs affect communication, decision making, or compliance with the plan of care? So working at Native American Hospital, like I said, I'm learning a lot about other tribes. I'm still even learning more about my own tribe, but also learning more about, our neighboring tribe and what their beliefs, their values, and traditions are. It's really helped me set aside my own bias, like I said, to fully respect the beliefs of other tribes and show respect not only to my patients, but their families, especially during sensitive spiritual times of end of life. Like I said, even the facing of which way the body needs to face during end-of-life care might seem small, but its deep spiritual meaning is related to the journey into the spirit world. So recognizing and honoring these beliefs directly affects communication and decision-making and care. Taking time to understand the patient's specific tribal customs also fosters trust, promotes open communication, and ensures that care decisions align with the patient's and the family's values. Failing to acknowledge these differences could unintentionally cause distress or harm, or undermine both cultural respects and the therapeutic relationship. The third question, what ethical or nursing considerations did or would you balance to respect the older adults' beliefs while providing safe evidence care? So for me, in balancing respect for the older adults' cultural and spiritual beliefs with the need to provide safe, evidence-based care, I would draw upon both ethical principles and the ANA Code of Ethics The principle of autonomy, beneficence, and cultural humility would be what guides my approach. Respecting that autonomy means recognizing that each patient, especially elders within the Native communities, has the right to make decisions consistent with their cultural and spiritual beliefs. Also, in a lot of decision making for family members, they go to the oldest or the elder of the family to make those decisions. So sometimes making sure that, following the hospital's protocols and making sure that that person it's okay to speak with, to make sure that we are carrying out their spiritual values and their beliefs and making the right decisions for them. Beneficence requires me to act in the patient's best interests, not only by addressing physical needs, but also supporting emotional, cultural, and spiritual well-being. So this balance means taking time to learn about the patient's tribal customs, listening actively to the family's input, and maybe even collaborating with the spiritual leaders that are assisting with the end-of-life transition. A lot of times people have a spiritual leader that will help come in and pray and make sure that their next journey is following our traditions or their traditions according to their culture and their tribal beliefs. And honoring that as long as it doesn't compromise with the patient's safety or quality of care. Incorporating these practices shows respect for cultural identity and builds trust, which is essential for effective communication and decision making. So like I said, respecting the prayer, their family, and spiritual leaders is essential, as prayer holds deep significance across Native American tribes. I think that's something that's in common with a lot of Native American tribes. We are held deeply in our prayer, but like I said again, some pray a little bit different than what I might be accustomed to. So it's important to honor the ways in which they may pray, and even if these practices differ from my own beliefs, ensuring that the rituals are conducted safely. And this aligns with Provision 8 of the ANA Codes of Ethics, which emphasizes collaboration with others to promote culturally safe and equitable care, and reflects Provision 1, which also calls nurses to practice with compassion and respect for the inherent dignity of every person. Nurses are tasked with honoring patients' spiritual beliefs while maintaining professional boundaries and providing safe and healing environment. Number 4, what strategies might you use to provide culturally sensitive spiritual care for older adults in a geriatric setting? So again, in a geriatric setting, in any setting, Native Americans believe that the elders basically are, well respected. They carry all our wisdom. And like I mentioned, a lot of times the elder or the oldest of the family is the decision maker. And so that's something that we need to respect. And if it's during the end of life care, then we would move on to, who the eldest or the older of the family is and establish that role with the family while following facility policies. And then ensuring that the patient autonomy is respected while honoring family cultural structure and decision-making practices. During this time, a lot of times, this is going back to the geriatric or the end-of-life care, when you find that designated elder or family decision maker, once that's identified, like I said, we need to make sure that the necessary information is provided so that way care is both culturally sensitive and clinically safe. Understanding that spiritual or ceremony practices may be important to the patient, prayer, smudging, traditional healing rituals, integrating them in the care plan whenever possible. The same time would educate the elder and the family about any clinical interventions being provided, explaining procedures respectful and culturally appropriate way. This collaborative approach fosters trust and ensures the patient's spiritual, emotional, and physical needs are addressed. A lot of things too are changing within Native American culture. I think that a lot of the older elders, while you're caring for them, there's a lot of things that need to be respected too. And I think communication and active listening is probably the best thing you can do to provide culturally sensitive spiritual care. I know a lot of women elders do not like men in their room or don't like to be alone in a room with a man or having a man, male figure, showering or grooming them. So basically, like I said, just being an active listener and really educating myself on what their cultural needs are. Also collaborating with spiritual leaders like we talked about before, so we can have have a guide to culturally appropriate care practices, making sure that we include any ritual safely. Like I said, a lot of people smudge, and a lot of facilities we're not allowed to smudge because of the smoke. Here at our facility, we do allow that, but we just have to contact our security so that way they can shut off anything, the fire alarms. And then that gives the elders and spiritual leaders the ability to smudge and pray how they want to for their healing. And that's in all care settings, really, not just geriatric or end of life. And then really promoting patient and family education. I think explaining medical procedures, interventions, and safety considerations respects their cultural framework, because then they have a better understanding of what's going on and maybe want to incorporate some of their traditional methods of healing, but also being flexible and an advocate for the patient, adjusting my care routines to, for instance, eating. A lot of people in Native American cultures, it differs from tribe to tribe, but believe that you can't eat after sunset, or things like closing the blinds at night to make sure that spirits can't look in, but again, because I'm working with so many different tribes, I try to make sure that I establish those and communicate that with the patient. So I might go in and say, is there, when I'm doing assessment, admission assessment, is there a certain time you like to have dinner? Do you want to make sure dinner is provided before the sun sets? At nighttime, when I go in there, assuring that the blinds are closed. Some like to watch, during the summertime, like to watch the thunderstorms, so I just make sure I communicate and address those things, so I'm incorporating their rituals safely. Also, in their environment, accommodating their spiritual practices within their environment and advocating for them, letting my other healthcare team know of the patient's cultural and spiritual needs. And then through all this, culturally informed communication is the center to all of these strategies, and ensures that the older adult receives holistic care that honors their spiritual beliefs, supports their family, and promotes overall well-being while maintaining evidence-based clinical safety standards. Thanks.